The silent danger within. Understanding and combating visceral fat. We often think of body fat as a uniform layer beneath our skin, the jiggly stuff we can pinch. However, lurking deeper within our abdominal cavity lies a more insidious type of fat, visceral fat. Unlike subcutaneous fat, which resides just beneath the skin, visceral fat surrounds our internal organs, including the liver, stomach, and intestines. 1 While a small amount of visceral fat is necessary for organ protection, an excess can pose significant health risks, often silently and invisibly. 2 Understanding visceral fat, its dangers, and how to manage it is crucial for long-term health and well-being. What exactly is visceral fat? Imagine your abdominal cavity as a crowded room. Subcutaneous fat is like the wallpaper, lining the outer edges. Visceral fat, on the other hand, is like packing peanuts, filling the spaces between the furniture, your organs. It's stored deep within, interwoven with and surrounding these vital structures. 3 This proximity to major organs is what makes excess visceral fat particularly hazardous. Visceral fat is often referred to as active fat because it doesn't just sit there passively. It produces various hormones and inflammatory substances, including cytokines, which can have detrimental effects on the body's overall function. 4 This metabolic activity distinguishes it from subcutaneous fat, which is primarily an energy storage depot. 5 Why is visceral fat so dangerous? The dangers associated with excess visceral fat are extensive and well documented. Increased risk of cardiovascular disease. Visceral fat releases fatty acids into the bloodstream, which can contribute to higher levels of LDL, bad cholesterol, and triglycerides. 6 It also promotes inflammation and can lead to the development of plaque in the arteries, atherosclerosis, increasing the risk of high blood pressure, heart attack, and stroke. 7 Insulin resistance and type 2 diabetes. Visceral fat can interfere with the body's ability to use insulin effectively, leading to insulin resistance. 8 This can eventually progress to prediabetes and then type 2 diabetes, increasing the risk of various complications affecting the eyes, kidneys, nerves, and heart. Increased risk of certain cancers. Studies have linked higher levels of visceral fat to an increased risk of several types of cancer, including colorectal, breast, pancreatic, and endometrial cancer. 9 The inflammatory environment created by visceral fat is believed to play a role in cancer development and progression. 10 Alzheimer's disease and dementia. Emerging research suggests a connection between visceral fat and an increased risk of cognitive decline and dementia, including Alzheimer's disease. 11 The inflammatory markers released by visceral fat may negatively impact brain health over time. Non-alcoholic fatty liver disease, NAFLD. Excess visceral fat can contribute to the accumulation of fat in the liver, leading to NAFLD. 12 In some cases, this can progress to more severe liver conditions like non-alcoholic steatohepatitis, NASH, cirrhosis, and liver failure. Sleep apnea. Visceral fat around the neck and upper airways can contribute to obstructive sleep apnea, a condition characterized by repeated pauses in breathing during sleep. 13 Asthma. Some studies have found a link between higher levels of visceral fat and an increased risk of developing asthma, possibly due to the inflammatory effects of visceral fat on the airways. 14 Other health issues. Excess visceral fat has also been linked to a higher risk of gallbladder disease, gout, fertility problems, lower back pain, and osteoarthritis. How do you know if you have too much visceral fat? Unlike subcutaneous fat, you can't simply pinch visceral fat to assess its quantity. The most accurate way to measure visceral fat is through imaging techniques like CT scans and MRIs, but these are expensive and not routinely used for this purpose. However, there are more accessible indicators. Waist circumference. This is a simple and effective way to estimate visceral fat levels. Measure your waist just above your hip bones, ensuring the tape measure is snug but not digging into your skin. For women, a waist circumference of 35 inches, 88 centimeters, or more indicates a higher risk. 0.15. For men, a waist circumference of 40 inches, 102 centimeters, or more indicates a higher risk. 0.16. For people of Asian descent, these cutoffs may be lower, around 31.5 inches for women and 35.5 inches for men. Waist to hip ratio, WHR. Divide your waist circumference by your hip circumference, measured at the widest part of your hips. A WHR above 0.85 for women and 0.90 for men suggests abdominal obesity, which often correlates with higher visceral fat. 0.17. Waist to height ratio, WHTR. Divide your waist circumference by your height. A healthy ratio is generally considered to be less than 0.5.18. This ratio may be a better indicator of health risks across different body sizes. Body shape. People with an apple shape, carrying more weight around their abdomen, tend to have more visceral fat than those with a pear shape, carrying more weight in their hips and thighs. Body mass index, BMI. While BMI doesn't directly measure visceral fat, a BMI of 30 or higher, indicating obesity, is often associated with increased visceral fat. 0.19. Strategies to combat visceral fat. The good news is that visceral fat is often more responsive to lifestyle changes than subcutaneous fat. The same strategies that promote overall weight loss and health improvement are effective in reducing visceral fat. Adopt a healthy diet. Focus on whole, unprocessed foods. Prioritize fruits, vegetables, whole grains, lean proteins, fish, poultry, beans, lentils, and healthy fats, avocados, nuts, olive oil. Limit refined carbohydrates and sugary foods and drinks. These contribute to increased calorie intake and can promote fat storage, including visceral fat. 0.20. Reduce unhealthy fats. Limit saturated and trans fats found in processed foods, fried foods, and some animal products. 0.21. Increase fiber intake. Fiber helps you feel fuller for longer and can aid in weight management. 0.22. Consider a Mediterranean or low-carbohydrate diet. Some studies suggest these dietary patterns can be particularly effective in reducing visceral fat. Engage in regular exercise. Aerobic exercise, cardio. Aim for at least 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity aerobic exercise per week, e.g., brisk walking, running, cycling, swimming. This helps burn calories and reduce overall body fat, including visceral fat. High-intensity interval training, HIIT workouts, which alternate between intense bursts of activity and short recovery periods, can be particularly effective at burning fat. 0.23. Strength training. Building muscle mass can increase your metabolism, helping you burn more calories at rest and potentially reduce visceral fat over time. 0.24. Prioritize sleep. Aim for 7 to 9 hours of quality sleep each night. Insufficient sleep can disrupt hormones that regulate appetite and metabolism, potentially 25 leading to increased visceral fat storage. 0.26. Manage stress. Chronic stress can lead to increased cortisol levels, which have been linked to greater visceral fat accumulation. Practice stress-reducing techniques like meditation, yoga, deep breathing exercises, or spending time in nature. Limit alcohol intake. Excessive alcohol consumption can contribute to increased visceral fat. 27 Moderation is key. Quit smoking. Smoking has been linked to increased visceral fat and numerous other health problems. 28. Consider intermittent fasting. Some studies suggest that intermittent fasting strategies may help reduce visceral fat, but it's important to consult with a healthcare professional before starting any new fasting regimen. Probiotics and prebiotics. Emerging research suggests that a healthy gut microbiome may play a role in managing weight and body fat distribution. 29 Incorporating probiotic-rich foods or supplements and prebiotic-rich foods may be beneficial. The takeaway: visceral fat, though hidden from plain sight, poses a significant threat to our health. 30 Understanding its dangers and taking proactive steps to manage it through a healthy lifestyle is paramount. By focusing on a balanced diet, regular exercise, adequate sleep, stress management, and limiting harmful habits, we can effectively reduce visceral fat and pave the way for a healthier and longer life. 31 If you have concerns about your waist circumference or other risk factors for excess visceral fat, consult with your healthcare provider for personalized advice and guidance.